It seems that a tremendous disease with a fatality rate of 75% is currently spreading in India. Of course, it won't spread on a large scale like COVID-19, but this disease, which has neither a vaccine nor a treatment, is spreading in India. Let's take a closer look at today's topic. Let's get right into it. The Nipah virus, a zoonotic infectious disease, seems to be spreading in India. Of course, there have only been 2 confirmed cases of the Nipah virus recently. There's no need to panic like we did with COVID-19, but since the fatality rate is between 40% and 75%, Asian countries are taking preemptive measures. The Nipah virus is a zoonotic infectious disease that spreads from animals like fruit bats or pigs to humans. When infected with the Nipah virus, it causes fever and encephalitis. Human transmission is possible, but it typically needs prolonged close contact, so transmissibility is low. Indian health authorities investigated 196 contacts of the 2 confirmed Nipah virus patients, and all tested negative. No new confirmed cases have been reported. The Nipah virus didn't suddenly appear in 2026. It already existed. First reported in Malaysia in 1998, it has since occurred intermittently in South Asia, including India and Bangladesh. If we look at the countries where it has spread so far, infections have only been reported in 5 countries: Malaysia, Singapore, the Philippines, Bangladesh, and India. Especially in the case of India, since the first infection was reported in 2001, there have been a total of 104 cases and 72 deaths so far, causing significant damage. Globally, there have been 750 confirmed cases and 415 deaths, as you may have noticed. Nipah virus is not very contagious, with a basic reproduction number of about 0.48. If this number exceeds 1, a major outbreak could occur. If it nears 1, it won't spread globally, but will stay as an endemic disease in certain regions. For example, the pandemic influenza virus had a value of 1.4, 1.6 original, 2.5 was about 2.5, and measles is 1218. Compared to those, the Nipah virus has a much lower transmissibility. If you want to compare it, it's actually closer to Ebola than to COVID-19. Of course, it's not at a stage where we need to panic right now, but that doesn't mean it's something we can just ignore either. The World Health Organization lists Nipah virus as a priority pathogen, meaning it's recognized as dangerous, not just based on appearance. It means that health authorities around the world are watching it most closely. If you look at what diseases are included on this list, you'll see a series of names that humanity has already struggled with severely at least once. It's right alongside deadly infectious diseases like severe acute respiratory syndrome, Middle East respiratory syndrome, COVID-19, and Ebola. Nipah virus is managed like other serious diseases, so we can't ignore it. World Health Organization uses clear criteria, starting with fatality rate, to make this decision. Nipah virus has caused death in 40% to 70% of infected people, depending on region and outbreak period. This figure can't be compared to the flu or other respiratory viruses, and the bigger issue is the limited treatment options. There is currently no commercial vaccine or proven effective treatment for the Nipah virus. Once infected, only supportive care to relieve symptoms is possible. This heavily burdens healthcare, with the main concern being possible mutation. So far, Nipah virus has mainly shown transmission from animals to humans, and limited human-to-human transmission. The problem is that this virus is a ribonucleic acid virus. Ribonucleic acid viruses are structurally prone to mutations. As with COVID-19, mutations can drastically alter how diseases spread and infect. If the Nipah virus mutates to transmit more efficiently between humans, it could become a much greater threat. A bigger issue is response time. If vaccines and treatments are ready, we can respond quickly even if mutations happen. But with the Nipah virus, there are no immediate tools. Research is still underway. Starting research after an outbreak likely means it's too late. This is exactly why the World Health Organization has listed this virus as a major target for surveillance. Although it is still limited for now, it has enough potential to turn into a major disaster the moment the right conditions are met. So, while we can say that the Nipah virus is not a big problem yet, we cannot be certain that it won't become an issue in the future. In other words, the reason this virus is dangerous is not because it is currently causing a pandemic, but because 3 factors exist at the same time: high fatality rate, lack of treatment, and the possibility of mutation. These are exactly the risk factors that the World Health Organization is most wary of. In the end, what matters is not fear, but vigilance. We've often seen that failing to prepare in calm times leaves us with no options when problems arise. And earlier, I mentioned that the fatality rate can reach up to 75%. Because the fatality rate is so high, as I said, countries across Asia are strengthening their quarantine measures, right? Korea's Disease Control and Prevention Agency designated the Nipah virus as a first-class legal infectious disease in September 2025 before it spread in India, and is preparing for its possible arrival. Right now, India and Bangladesh have been designated as quarantine management areas and are being monitored, but with the outbreak of the Nipah virus, they were able to respond preemptively. Medical institutions must report to the Disease Control and Prevention Agency or local health center if a patient who traveled to a Nipah virus-affected country or had animal contact shows suspected Nipah virus symptoms. The virus is unlikely to spread to Korea for now. Disease Control and Prevention Agency Director Lim Sung-gwan stated there are no new cases in India currently. He also said that since the fatality rate is very high if infected, it is especially important to take precautions to avoid exposure to the risk of infection. Nepal's response shows how seriously they take this issue. The Nepalese government has declared the highest alert and raised the quarantine system to the next level. At Tribhuvan International Airport, they have significantly increased the number of quarantine personnel from the entry stage and have strengthened symptom checks and fever screenings for all international passengers. They've also applied the same standards to all land border checkpoints with India. Nepal has frequent travel to and from India, so they know that relaxed border controls could quickly raise the risk of infectious diseases entering the country. In border areas, they manage movement and reorganize the system to allow immediate on-site isolation if suspicious symptoms appeared. Vietnam responded quickly too. At Hanoi Noi Bai International Airport, they managed flights from India separately and measured the temperature of all incoming passengers. What's important is that these measures were not limited to just the airport level. The Vietnamese Ministry of Health urgently sent identical response guidelines to health authorities in 31 provinces and cities. This was a measure taken with the possibility in mind that infected individuals might have moved to local areas after passing through the airport. Local health authorities were told to review reporting for suspected cases and improve surveillance in medical institutions. Vietnam controlled COVID-19 well due to quick coordination between central and local authorities and appears to be applying that approach again. Is Thailand's response even more systematic? The Thai Ministry of Health has introduced a 3-stage quarantine at Suvarnabhumi, Don Mueang, and Phuket airports. In the first stage, all incoming travelers have their temperatures measured remotely using thermal imaging cameras. If any abnormal symptoms are detected, they move on to the second stage, where individual temperature checks and symptom interviews are conducted. In the final stage, all passengers arriving from West Bengal, which is classified as a high-risk area, are required to fill out a health declaration form. This form is not just a simple document, it serves as a starting point for epidemiological tracking if symptoms appear later. Thailand relies heavily on tourism, so airport restrictions impact its economy. Still, these strict measures show health is being prioritized. Singapore faces similar situations. The Singapore Infectious Diseases Agency checked the temperatures of all passengers from infected areas in India at Changi Airport. Singapore is a small country, but it is a global aviation hub. If an infection is introduced, there is a high possibility that it could become a transit point for international spread. That is why Singapore considers early containment as its most important strategy. They try to screen as much as possible at the airport stage and maintain a system where suspected cases are immediately connected to the medical system. This response method is based on experience from past severe acute respiratory syndrome and COVID-19 outbreaks. Pakistan is enforcing strict quarantine from the 29th, requiring 100% quarantine at all entry points, airports, ports, land borders, and others. All travelers, regardless of nationality, must provide their complete 21-day travel history, including transit points. The government will review this directly through the National Border Health Service. If you do not have a health permit for that period, you will not be allowed to enter the country. If you are classified as a suspected patient during the quarantine process, you will be immediately isolated at the entry point. After that, there are procedures in place to transfer you directly to a designated quarantine facility or a tertiary hospital. This is not a post-response measure, but rather a measure that reflects the determination to block risk factors at the border itself. If you look at the responses of each country, you can see one thing in common. Even though large-scale spread has not yet been confirmed, they are building the tightest possible line of defense centered around airports and borders. This means that this issue is not being seen as a short-term incident, but as a potential crisis that could have a significant impact if not managed properly. I sincerely hope that it does not lead to major damage. What do you think about the Nipah virus? Please let me know in the comments. That concludes the video. Thank you.